The narrative of no money for medicine is starting to change. For the last 2 years, the collapse of the naira and soaring import fees turned basic healthcare into a luxury. Many patients were forced to choose between completing their dosage or paying for food, leading to a dangerous rise in self-medication. Now, the trend is reversing. A survey of pharmacies in Abeokuta confirms that the prices of key medications, especially for chronic illnesses and common infections, are actively trending downward following recent federal government policies to subsidize raw material imports.
There is, but it's not that significant. There are a lot of factors that can mitigate against seeing the rapid change in price. And part of the factor is an APIs, which is the active pharmaceutical ingredient, the active ingredient in all these molecules that you are looking at, they are not readily available in Nigeria. We source for over 80% of those molecules outside Nigeria. Like I said, if you can leverage on good stability in the exchange rate, and if government can come up with loans for pharma companies, loans that are of single interest, I think it will be a good way at which people can feel the reduction in tariff that government earlier announced.
The relief is tangible for many families, but patients are quick to note the limitations. While prices have moved, they remain steep compared to current income levels for the average household. The cost of healthcare is still a heavy burden that requires more than just a marginal price adjustment.
To buy drug now is very exorbitant. Unless if you go to a big supermarket, you can get someone less. Because likewise, my wife is using one tablet. A sachet of one tablet is 6,000 naira. And if she did not use it, it will cause him a problem.
And on the rates they buy the markets, there are different companies they buy the markets. All the companies, they are not the same. That is, the products are not the same.
The expert verdict is unanimous. We cannot rely on import relief alone. Pharmacists and healthcare leaders argue that Nigeria's true vulnerability lies in its dependence on imported pharmaceutical raw materials. To protect citizens from future price shocks, the focus must shift to incentivizing local manufacturing firms to produce essential medicine within our borders.
Some of the suppliers are still finding it very difficult to regulate their prices at that level. When we saw this particular challenge, even in our with that, it was still affecting our prices because patients kept coming. Now they are no longer going outside to purchase their medicine because it's affordable now. The turnover had made the account stable, and we're able to purchase and pay our suppliers.
As the market stabilizes, the public is reminded to exercise caution. Experts are urging patients to avoid the temptation of buying medications from unlicensed vendors, as the market adjustments period often creates opportunities for substandard and counterfeit products to circulate. The goal for the nation is clear. Healthcare must be determined by medical necessity, not by the size of a patient's pocket. As this policy takes root, the public is watching to see if this decline is a temporary fluctuation or the beginning of a sustainable healthcare recovery. Olaide Oloye-Soluade, OGTV News.